So hello everyone and welcome to the second video of this radiology series. So in today's video we'll be talking about how to explain a radiology specimen from the thorax section. So here I've taken a normal radiograph showing the thorax and the chest wall mainly, and it is a normal specimen without any other diseased conditions. So first we'll understand the normal and what all happens in the disease condition as follows. So the first thing, as we studied in the radiograph of the upper limb also, over here also we have to state some basic things before explaining the x-ray, that it is a plain x-ray. So most of the x-rays in the thorax are also a plain x-ray, and the interesting fact about the thorax x-rays are they are a PA view x-ray. In the upper limb we saw that the x-rays were usually AP view. And why is it a PA view? Because usually when we are taking a thorax x-ray, the rays are coming from the posterior side towards the anterior side, because the person is facing to the x-ray machine backwards. So hence that's why the view that we are getting is the posterior anterior. So for the thorax x-ray, when we start to explain it, we have to say that it is a plain x-ray with a PA view. So now coming to explaining the x-ray, there's a simple mnemonic that will help you to remember how to explain the x-ray, that is ABCD and then ABCD again. So I will explain it as follows. So the first A stands for air. So the air, when the moment of taking the x-ray, we tell them to take a deep inspiration, so the lungs get filled with air, and that's why they appear in this blackish color, and they are visualized better. And also another structure which will have the air is the trachea, which we can see in this case here, and it is in the midline. So if the trachea has any shift from the midline, we can understand that there's some kind of disease condition causing a mediastinal shift. So that is the importance of the air. Then coming to the bones. So the next, the B stands for bones. So in this case, the major bones that are seen are your ribs, and along with that the clavicle. When we're coming to the ribs, in this case, this section that is seen over here is the posterior part of the ribs, and you can see all the ribs here from 1 to 12, and the posterior parts of the ribs are what are seen more prominently, and along with that you have the clavicle. So that is the first B. Then coming to C is the cardiac shadow. So the cardiac shadow is what we are seeing here, and that's what I've outlined here over in red. So the cardiac shadow, when we are coming to the cardiac shadow, we can see on over here the shadow of the SVC, and this is the right atrium. When we're looking towards the other side, we can see a knuckle here which is known as the aortic knuckle. Then we can see the shadow of the pulmonary trunk, particularly the left pulmonary artery. Then here we can see the shadow of the left ventricle. So when we come to the cardiac shadow, it should usually only be 50 to 55% of this entire transverse diameter, or when we're coming to mathematical terms, this length A plus B that we are seeing here should be always less than half of C. Half of C meaning the C is the entire transverse diameter, and it should always be less than half of C. That's why we say it should be 50 to 55%, and if it is more than that, it is a case of cardiomegaly. Then that is all about the cardiac shadows. After the cardiac shadows, we talk about the diaphragm. So when we come into the diaphragm here, as I've outlined in green over here, in this side, that is on the right hand side, it is right below the diaphragm. This position is occupied by the liver, and when we come to the left hand side, we can see that is occupied by the stomach, and this area of opacity over here, that is the fundic shadow, and it is the air that is present in the fundus. Now coming to the angles, the major two angles that we can visualize in this are the costodiaphragmatic angle and the cardiophrenic angle. So the costophrenic or the costodiaphragmatic angle is the angle which is seen in over here. This costophrenic angle or costodiaphragmatic angle will get abolished in pleural effusion. That is the disease condition in which it gets abolished. And then you have your cardiophrenic angle over here, which gets abolished in pericardial effusion. Then the next B that we're talking about is the breast or soft tissue shadow, which is not much prominent in this X-ray here. Then collection of fluid, as we already told, in pleural effusion your cross-phrenic angle will get obliterated. Then densities we mean any enlarged lymph nodes, any tumors, any foreign bodies which are present in the trachea or anywhere in the lung, which we can see in other X-rays showing disease conditions. So that is a simple way and a simple mnemonic to remember the various aspects of the neck of this X-ray. So it is a ABCD followed by another ABCD. The first ABCD consists of air, the bones, about the cardiac shadow and the diaphragm, and the second set of ABCD we talk about the angles such as the costophrenic angle and the cardiophrenic angle. Then we have the breast or the soft tissue shadows, collection of fluid, and the densities. So I hope with this you have understood how to explain X-ray of the thorax, and always start the X-ray by talking about that if it's a plain or a contrast X-ray, and always talk about the view before going into other details. Hope you guys have understood, and thank you so much for listening.